Of all the adults or adolescents that a psychiatrist would say have social anxiety or social phobia, some acquired it. They didn't have any special temperamental or genetic bias, but some did. The temperamental bias, which is inherited, is not for shyness. What you inherit is a tendency to overreact to anything that's new, novel, unfamiliar.
We know that a particular circuitry in the brain of animals is reliably triggered when those animals experience fear in particular laboratory situations, something called conditioned fear. And it specifically involves a brain structure called the amygdala, which is kind of the central part of the brain for fear responses.
This structure always fires when anything new happens. You hear a sound you didn't expect, you see a sight you didn't expect, a smell you didn't expect. And we think that the children who are born with this bias to overreact to novelty inherit a neurochemistry that makes this structure, the amygdala, very excitable.
In a groundbreaking study, Dr. Jerome Kagan of Harvard University videotaped the reactions of infants to unfamiliar stimuli. His research suggests that some infants have a temperamental bias to experience anxiety.
If you were an infant with such a chemistry, then if we showed those infants interesting stimuli they never saw before, like mobiles, colorful dolls that were moved in front of their face, that if you had this chemistry, you would begin to show this motor vigor and begin to cry because we had passed your threshold. That is a sign that you have inherited a chemistry in the amygdala that has rendered it very excitable. Therefore, for the rest of your life, you should be biased to react to unfamiliar things with an initial restraint.
Kayla, what did you learn yesterday? Did you have your picture in your desk? Is your picture in your desk? Can you share it with us?
Kayla is 7. She suffers from a disorder called selective mutism, which is a form of social anxiety disorder.
There are some children that just manifest social phobia this way. They just literally shut down. And they do it with their voice because that's their easiest way of not communicating, not interacting. They find that, and over time they learn, that's like a learned behavior. So they shut down and they don't speak, so no attention will be brought to them.
Do you brush your teeth every day? Yes or no? Do you brush them every day? Yes? Are you shaking your head, Jess? I didn't hear it rattle. Shall I come back to you? Okay, I'll come back to you.
These children want so desperately to talk, and they can't. The words just don't come out. They can't speak. It's stuck. I've had little kids tell me that they're stuck in their throat, they're stuck in their chest, their tongue's playing tricks on them, their lips won't open up right, their mouth just doesn't work, their brain is telling them not to talk.
Brad, who's your neighbor?
When I watch my daughter in the classroom, it's very painful to see her struggle and not be able to interact with the other children like they do, and just breaks my heart.
But before Kayla was diagnosed, Sherry was filled with frustration and anger.
I can remember yelling at her, saying, why are you doing this? Quit embarrassing me. And I really thought that it was some kind of control, that she was doing this almost on purpose. I mean, this child was suffering from major anxiety, and I just didn't understand.
It's often difficult for parents to tell that these children have social phobia or selective mutism. Reason being because at home they're comfortable and they're totally fine.
Can I go first?
They're often bossy, they're stubborn, they're very assertive.
You got that one.
Oh.
Everybody got you. Give me $1.
Guy am I?
Shh.
Sherry has suffered from anxiety for many years, but she didn't associate her feelings of fear with Kayla's behavior. And then one day, she had to give a speech to a classroom full of her peers, and reality hit.
The fear that took over my body, I mean, I was literally feeling sick, I was sweating, and that's when it brought so much light to me. I'm like, oh my gosh, this is what my daughter is feeling every single day.
Who lives close to you?
In the majority of cases, this anxiety is hereditary. It's passed on from one family member to the next. So when these parents find out that the symptoms that these children have are due to anxiety, it makes them take a step back and realize, this is me, this was my brother, this was my sister. All of these things that my child is going through is what I went through and what I'm feeling.
It's just been a real eye-opener for me. I've learned so much about myself. It helps me to understand myself better, and mostly it helps me to understand Kayla.
This is me on the map of my room.
Natalie is Kayla's best friend in school. I cherish their friendship because Kayla has come so far this year. And a lot of the credit goes to Natalie and to her teacher, Mrs. Decker.
Nope. All she keeps saying is no.
These children tend to bond with very outgoing children because they will do the speaking for them. And that's what you see with Kayla. You see Kayla having bonded with Natalie.
Well, when she's shy to talk, she just tells me and she whispers it to me and I say it for her.
Where's the Pacific Ocean?
What? And I made her talk because the first she was reading to me and I keep telling her that she could do it.
Kayla's come a long way. She's got good friends in school and she speaks with Natalie. But in order for her to fully recover, Dr. Blum has suggested that she take antidepressant medication.
We should start them on very low doses of medication in order to lower their anxiety level. The children are much more receptive when their anxiety is lower. They're able to perform the things that we need them to do.
Once Kayla becomes more confident and comfortable in the classroom, she will be slowly taken off her medication.
The prognosis of selective mutism, when it's viewed from an anxiety perspective, is excellent. These children overcome selective mutism. So if we can give them the coping skills and develop behavioral techniques to be able to deal with a stressful situation, they're able to carry that over into their life as they get older.
Now I try to look at things in such a positive way, and I know that, we recognize the problem and that we're getting help for her, and she's going to overcome this at a young age. And she won't hopefully have to go through the pain all these years that other people do.
Kayla is fortunate. She's growing up in a time when many doctors and families are recognizing this disorder in children. But for socially anxious adults like Chris, the diagnosis took years.
Last time I came.
Chris is visiting his parents' home for the first time since he has started treatment for social anxiety disorder. The conversation brings up painful memories of a lonely child, as documented by his mother, Audrey, in her diary.
But I can see going through this. There's a number of times when I do mention shy, and I mean even one particular place where I'm actually concerned about Chris's personality. He didn't want to leave the yard all last summer. He wouldn't talk or even look at others. He wouldn't go to the neighbors' houses and had trouble with Sunday school and library school.
Yeah, I mean, I know there were some problems because I didn't feel comfortable. I remember I'd go down to the bus stop and everybody would sit on one side of the street, and for some reason I would stay alone on the other side by myself. So
There's another aspect in our family. I have cousins that have social anxiety situations, but I have lots of aunts that have had phobias. Grandma couldn't walk around the block unless you and Corey were with her because her legs would be like rubber. Aunt B couldn't go on a bus. They all had heart palpitations, anxiety attacks. It's a chemical situation that has affected just about all 11 aunts and uncles of mine, and it's now come down to second and third generations. Very heart-rending to think that you were experiencing these things, and and I would have loved to try to help you with it.
Social anxiety affects more than the people who suffer from it. It also has an impact on everyone who loves and cares for them.
So do you think you've gotten everything you want to get for your mother for Christmas?
I feel at times so sad that she has so much capability, so much intelligence, beautiful woman, you know, has everything in the world going for her, but she can't recognize it.
I think at the party,
that's extremely painful for me to watch. Is somebody that I care so deeply about.
You know, when she thinks, okay, I'm ugly, I seem unprofessional, all of these thoughts, my first reaction is to just say, you're crazy. I think it's hard because I've always seen so much more in her than she sees in herself.
I didn't know I had social anxiety disorder, and they didn't have a word for it back then anyways. I mean, I was pretty depressed, not very happy. See, I feel bad for even my parents watching this. I cried myself to sleep a lot. But I don't know if I want them to know that. I was suicidal, you know, a lot, and they didn't necessarily know that, but I mean, I think I have it over in my high school yearbook that I wrote some letter in there. I think maybe I've hidden it that I would kill myself at a certain point if things didn't get better.
In high school, I didn't have too many friends. I was a lot smaller than some of the other kids. I kind of got picked on a lot, beat up a lot. It's especially tough dealing with this disorder, I believe, being a guy, because we don't want to show our weaknesses, and with the social anxiety, being shy and reserved, that's a weakness.
don't worry, just relax and have fun. You're perfectly safe.
So I try to compensate in other areas by doing things like skydiving, getting involved in sports, bungee jumping. But I think I did a lot of crazy things to try to show my manliness, I guess.
There's always outsiders in every high school, but I mean, I felt like I was on the outside of the outsiders, because I was just completely alone with everything I was going through and everything I went through. And it was tough just seeing other people having at least one friend, you know, just to, you know, get through it all with. And I didn't fit in with the other kids and all that, so I mean, there were a lot of bad experiences just getting through high school.
When we went looking at colleges, I picked the easiest thing I possibly could, the closest thing I possibly could, when, you know, at that time in my life, I should have been looking for something challenging and exciting. And I went to secretarial school. It was the easiest thing I could think of. I knew how to type, I knew how to do all that stuff. I wouldn't be threatened, I wouldn't be challenged, and it would be easy.
I further progressed in college. I would miss my classes. I'd sleep on the couch all day. Just a lot of depression. I drank a lot. If I drink, then it eliminates some of the anxiety. Feel a little more comfortable talking to people.
One study showed the median age of onset of social anxiety disorder was age 13. That means that there are a lot of shy, anxious, socially inhibited children who are probably labeled by their teachers as model students because they're not disruptive, they don't disturb anybody, they're quiet. And it's probably not recognized that these children are terrified to raise their hand, having a lot of trouble making friends because they get nervous in these social situations. And these children have a very, very high risk to grow up, to continue to have these problems, to develop depression, and also develop substance abuse problems, because a large number of people with social anxiety disorder realize, unfortunately, that alcohol is one way to calm you down in a social situation. So we really want people to pay attention to this, even in school-age children.